So speaking about Vamana Virechana Vyapat Siddhi, so first we'll just brush up few topics of Vamana and Virechana. Until this point we have discussed, just we have brushed up what are all the procedures of Vamana. Okay. Similarly, there is for Virechana also with slight deviation of how many days of gap is given and what is the Antiki Lakshanas of Virechana, the indications of Virechana. There are few points where Vamana and Virechana might differ. Okay. So Panchakarma is a set of 5 procedures which is comprising of Vamana, Virechana, Asthapana Basti, Anuvasana Basti and Shiro Virechana. Where here the Ratna Mokshana is not considered yet. So Acharya Sushruta, while on the other side says Panchakarmas are Vamana, Virechana, Basti, Nasya and Rakta Mokshana. So the elimination of the vitiated Vata, Pitta and Kapha doshas in Varsha, Sharad and Vasanta Rutu respectively. This is like the Rutu Shodhana, what should be done. Then, Basti Karma is performed in Varsha Rutu due to vitiated Vata dosha, Virechana Karma in Sharad Rutu due to vitiated Pitta dosha, and Vamana Karma in Vasanta Rutu due to the Prakopa of Kapha dosha. So, unexpected situations can arise during or after Vamana and Virechana Karma, and this may lead to a very difficult condition in different patients. Okay, so unprocessed medicines can be there, or inaccurate dosage of Aushadha Dravya can be there, or there is Hina Sattva of the Rogi, or there is improper Snehana and Svedana may produce the Vyapat during or after the Vamana and Virechana Karma. So the administration of the administration of the Aushadha for the Samshodhana Karma eliminate the vitiated doshas after Samyak Snehana and Svedana. But without Snehana and Svedana, it aggravates the vitiated doshas and cause various symptoms in the body, like namely Vibhramsha, Shota, Hikka, or Vivaranata. Like this, many complications may occur in the body. So we have to be always diligent in our process of how we do the Purva Karma, how we do the Pradhana Karma, how we do the Paschat Karma. Right? So the complications are occurred if the dosage of medicine is low or high. In that case, also it can be. Or unprocessed medicine is given. Inaccurate timing of the administration drug. Then the medicine is too old. So it has lost its potency so that it is not working properly, giving its effect properly. The patient may suffer from critical condition if meticulous care is not taken during the administration of Vamana and Virechana Karma. So always the doctor has to be near to the patient, observe even smallest of the changes that starts appearing in the patient. Okay, so we should not fall out of our duty of observing the patient very meticulously once the uh, Vamana or Virechana Aushadha is administered. So there are few reasons where the Vamana and Virechana can be of a poor response. Okay, so improper Snehana and Svedana prior to the administration of Vamana will be the first cause among them. So administration of small dose of Vamana Aushadha in a physically strong person, or intake of Vamana Aushadha or Virechana Aushadha that are old and of poor quality, or subjecting the Vamana Karma in a patient having Koshtha of the Krura type, that is Krura Koshtha patient. Then administration of Vamana Karma in the presence of Ama. Then consuming the Vamanopaka drugs or Vamanaushadha when the Agni is unusually strong. These are all the conditions. That is why we have to do the Dashavida Pariksha, Ashtavida Pariksha in a very thorough manner. We cannot just administer the patient with sneha with the sneha just as casually as it is. No, we cannot do that. We have to take care of Agni, the Rogi Bala, the Roga Bala, the Koshtha, as well as the timing, that is a season, right? So then at what time of the day is that medicine given? So all these we have to think of. And you are at a stage in fourth year of your study, so you have to be you have to take care of these things. Go to IPD, check out when exactly the Vamana Aushadha is given, at what exact time it is given, at what exact time Virechana Aushadha is given. So as you guys know, Vamana Aushadha, we start really early in the day to administer the Vamana Aushadha, right? But in the Virechana Aushadha, what happens? We administer at Kaphanta Kala. What is the Kaphanta Kala? if we take example like it like as a tridosha clock, if we say, so it is about 6 a.m. in the morning till the 10 a.m. in the morning, it is kapha kala, kapha predominant kala. Then the 4 hours, the successive 4 hours is pitta kala, then successive 4 hours is vata kala. So if I am administering the virechana aushadha at 8:30 or 8 o'clock in the morning, what effect, the desired effect, can I get the desired effect? No, I cannot get it. But I have to, if I give it at the kapha antya kala, that is to say 9, 9:30, at that time, if I'm administering the medicine, then there is more effective way of, I mean, the results can be more effective at that time for the Virechana. So these are the few things that we have to think of. Okay. Then further, we will move on to Vamana Virechana Vyapat Siddhi. So as we understood that there are few cases where even though wrong things are not done, but there is, I mean, the administration is very much proper, but the digestion inside is going wrong. If that happens, then also it results in Vyapat. So, mainly two cases. One, administration itself is wrong. Second, administration is right, but the digestion is wrong. Both the cases can happen. Very frequently, we come across these two cases. So as we know, now Vamana Virechana Vyapat Siddhi is being explained in Charaka Siddhisthana, 6th chapter. And then in Sushruta, we come across this Vamana and Virechana Vyapat Siddhi in Chikitsasthana. So just remember this point. There might be a Viva question that flares up saying where exactly Vamana Virechana Vyapat or Basti Vyapat is explained in Sushruta Samhita. It's explained in Chikitsasthana. The last 6 to 7 chapters of Chikitsasthana is dedicated to Panchakarma. Okay. Then in Charaka, it is explained in Siddhisthana. Sixth chapter is Basti Vyapat. The seventh chapter is, sorry, sixth chapter is Vamana Virechana Vyapat and the seventh chapter is Basti Vyapat. So now the first case is administering the medicine, administering the Vamana Aushadha or Virechana Aushadha to the patient. What can go wrong here? I have given Vamana Aushadha, but it has resulted in Virechana. This case can happen, the first case. Second, Virechana Aushadha is administered, but it can result in Vamana. This can also happen. So, before we understand what are all the specific Vyapats that can result into, we have to understand when this Vyapat actually takes place, right? So when does this Vamana Aushadha we have administered and it turns out to be Virechana? When this happens, Kshudha Pidita. Second condition, Mrudu Koshtha. Third condition, Swalpotklishtha Kaphenava. Fourth one is Tikshna. So what does this mean? So Vamana Aushadha is being administered, but it resulted in Virechana happens at four different case scenarios. One, the patient should be hungry when I give, I mean, the hunger state has already been developed in the patient. At that time, I'm giving the Vamana Aushadha. If this happens, it may result in Virechana. Why? Vamana Aushadha is generally given at around 7, 7:30 in the morning because we start the process at around 6 o'clock in the morning. Then at around 7, 7:10, like after one muhurta, I mean, sorry, before that one muhurta of the time, we are also giving the Vamana Aushadha. So it will generally be given in the Kapha predominant time period of the day. That means to say the Agni has not yet increased in its quantity and quality at that time. But if at all I give the Vamana Aushadha at the time of around 8:30, 9, 9:30, what happens? The hunger state has already been set up in the body. So my desired action is Vamana, but I have given in the wrong time, so it resulted in Virechana because it underwent digestion. It underwent Pachana at that time as Agni is more, so it resulted in Virechana. Second one, there is Mrudu Koshtha of the patient. So in few cases of Mrudu Koshta patients, Vamana Aushadha is given, but it resulted in Virechana because there is so fast action of the Pachana. That is why it resulted in Virechana. Then Swalpotklishta Kaphenava. So they are saying if there is Utklishtata of the Kapha, of the Pravruddha Avastha of the Kapha is very much less. That means to say there is no much Utklishta Kapha Avastha in the patient. Why do we administer kapha utklistakara ahara before the day of Vamana. That is to maintain utmost increase of kapha state in the body. Right? So if that case is not there, if the previous day of the Vamana, kapha utklistakara ahara is not given, and in general scenario also, that Vamana patient is not so much indicated to Vamana. We have considered him for Vamana, but his condition is not that much inclined towards the desired effect of Vamana. That means to say there is no that much of utklishtata of kapha. Then also the Vamana Aushadha may result into Virechana. Okay. Then Tikshna, if more Tikshna Aushadha is given for Vamana, that may also get digested and it may result into Virechana. So please remember these 4 points. Vamana, when it turns out to be Virechana. Vamana Aushadha is given, but it turns out to be Virechana. 4 conditions. One is Kshudha Pedita, Mrudu Koshtha, Swalpa Utklishta Kapha, and Tikshna Aushadha. Okay. Contrarily, there is one more case where Virechana Aushadha is given, but it resulted in Vamana. It didn't get into proper digestive mode, but it actually resulted in Vamana rather than getting into Virechana. When this happens, there are 5 conditions here. Shleshma Utklishtena, opposite. Shleshma Utklishtena, that means to say, there is more kapha, increased kapha avastha. In that state, the Agni, that kapha, increased kapha, won't allow the medicine to get into contact of Agni more. That is when Vamana can result in. Second, Durgandham. We have heard about Chardi being infused because of or instigated because of Durgandha, right? The fifth type of Chardi. So this Durgandhata of the Aushadha can also result in Vamana, even though the medicine was given because of Virechana. Then Ahridyam, almost related to Durgandha. Then Bahu, if the medicine is given too much than the desired quantity. At that time also, it doesn't go into digestive mode, hence it can result in Vamana. Then Ajirna. Patient itself is in the Ajirna avastha. At that time, if you are administering the medicine, then Virechana is not the result, but it may lead to Vamana. I hope you are remembering now. It is, and the point is very much clear. Okay. I'll repeat it once again. Vamana Aushadha given resulting in Virechana happens at 4 cases. Kshudha Pedita, Mrudu Koshta, Svalpa Utlishta Kapha, and Tikshna Aushadha. But Virechana Aushadha is administered, but it is resulting in Vamana. This can happen in 5 conditions. Sleshma Utklishta, Durgandha, Ahridya, Bahu Aushadha, and Ajirna Avastha. Okay. Then how many Vyapats have been told by different acharyas? We understood, okay, there are different types where the Vyapat can happen. We understood that, but what is the exact number? Charaka Acharya says 10, Sushruta Acharya says 15, and Vagbhata says 12. So remember the number. Acharya Charaka says 10 Vyapat for Vamana Virechana, Sushruta says 15, and Vagbhata says 12. And mind you, in this Vyapat, both Atiyoga and Ayoga Vyapats have been included. There is no specific numbers and division saying this much is Atiyoga, this much is Ayoga. That means to say there is no different context in which they have been explained. They have been explained under one single heading of Vamana Virechana Vyapat, which constitutes both of Atiyoga and Ayoga. According to Charaka, it's 10 in number. Then what is Ayoga? We have to define Ayoga, right? Pratilomyena doshanam haranat te hi akritsnashaha ayoga sangne. That means to say, Pratilomyena. That means to say when we gave Vamana Ushada, but it resulted in Virechana. As like we explained in the previous slide, we wanted Vamana to happen, so we gave Vamana Ushada, but it resulted in Virechana. So there is a different exit point. At this also is called as Ayoga of the Shodhana. Then that means to say Virechana is resulting in Vamana, while the Vamana Ushada resulted in Virechana. Then dosha is expelled in less quantity, or it is not at all expelled, or it is expelled with difficulty. These 3 conditions also come under Ayoga. So first condition is different exit point. Then second is dosha expelled in less quantity, or it is not at all expelled, or it is expelled with difficulty. Doshanam haranat. Okay. In these two broad headings of different exit and what is the condition of expellation of dosha, ayoga is being defined. So what is ati yoga? So we understand it as there is more vega, there is more quantity of vamana or virechana bouts that is happening, or the quantity that is gained at the last is very much more, or it is causing the patient to lose blood, or it is causing the patient into prolapsed state of any organ. These are all few points which come under Ati Yoga. Then Aushadha administered, but no proper Shodhana is happened. So what is this state? पीतौषधो न शुद्धः चेत् अजीर्णे तस्मिन् पुनः पिबेत् औषधं न तु अजीर्णे अन्यद्भयं स्यात् अतियोगतः. So what it is trying to say, aushadha is administered at first point, but no proper shodhana has happened in the person. There can be two conditions. What is that? If digested, if the medicine that is given for the desired action of Vamana and Virechana is digested, then but still the Shodhana has not happened, then we have to repeat the medication. I hope you got the point. One, you have given the medicine. Two, Shodhana has to happen. But in this condition, what has happened? You have given the medicine, but it has not gone into proper Shodhana. There can be two things. Aushadha is given, it can be digested. Aushadha is given, it is not digested. There can be two conditions, right? So Aushadha is given. In the first case scenario, it was digested, but still it has not resulted in any Shodhana. That means to say the body absorbed it. It did not result into Vamana or Virechana. At this time, what has to be done? If you can make sure that it is digested because of the Lakshanas it imparts, then you have to repeat the medicine the very next day. This can happen in clinic when you sit in the clinic and you administer Panchakarma. So the Agni is so much that even if when the proper quantity of medicine is given, that was less compared to the Agni of the patient. So at this time, what happens? Aushadha is given, it got digested. It did not result in any Shodhana. But in this case, you shouldn't stop at that. Next day, you have to again give the medicine. Why? Because this is one type of ayoga of Vamana or Virechana. Then, if not digested, so this is the second case. Aushadha was given, but it has not digested. Medicine is concealed inside only. It has not been digested. It has not been absorbed into the bloodstream. Then we don't have to repeat the administration. Why? Because it might have taken long time for Vamana or Virechana Vega to start. Okay. But at this time, if I administer the medicine again, even not considering that it has digested or not digested, then it may result into Ati Yoga. That is why I have to I have to not repeatedly administer the medicine in this case. I'll come back once again. First, after this Nehapana, that Vishrama Kala, everything, on the day of Shodhana, I have given Vamana Aushadha or Virechana Aushadha to the patient. First thing what happens, it can get digested. At this time, it did not result into Vamana or Virechana. What I have to do? The very next day, I have to repeat the medication. Second case, I have given the medicine, but it has not digested. It is taking long time for the Shodhana process to start. At this time, what happens? Medicine is concealed inside the body. Then we are not supposed to repeat the administration of Aushadha because it may result into Ati Yoga. I hope now the point is clear. Why this is important? Just not those 10 points of Vamana Virechana Vyapat is important. The previous points resulting into that Vyapat is also similarly important. What happens here? If digested and you give once again, what kind of medicine has to be given then? Mrudu or Tikshna Aushadha has to be given. Then that means to say, should I give Mrudu or should I give Tikshna? This assessment, Yukti, I have to use. The doctor has to use. Then we have to also assess whether the Koshta is in Guru or in Laghu Sthiti. And also I have to understand the Roga Bala, Rogi Bala, Koshta Bala. Considering these 3 points, I have to repeat the administration of the Aushadha. Then, when not to repeatedly administer the Aushadha. Second thing was it didn't get digested, so I should not give the medicine, right? I should not repeat the medicine. So, when not to repeatedly administer the Aushadha, there are some cases where I have to consider. Constraints are there. What are those? Duschardham. That means to say, the patient, you want to give Vamana to him because he is indicated for Vamana. But his Prakriti itself is that he cannot do the Vamana properly. In that case, you should not repeatedly administer the Aushadha. Second, already given the Vamana Aushadha, but Vamana happened in small quantity or no Vamana at all. At this point also, you are not giving. You are not repeatedly doing. Then Dushkoshtham. Virechana happens with much difficulty to this patient. Some patients, when you start the clinical practice, they say, I have never experienced Chardi at all. I have not experienced, not in much case scenarios I have experienced, even though my stomach was upset, I threw up, like with the Vamana kind of thing, I threw up, but never have I experienced Atisara. Some patients do tell like that when you discuss them the treatment options about Vamana, Virechana and all, they say this. Some people don't have the habit of drinking milk at all. To them, how will you, even though they are indicated for Vamana, how will you administer Vamana to them? And giving Ikshurasa or Dadhi is not that much of a feasible option, okay? So generally we give milk only. So in that case, what alternative should you find? Or is there no alternative at all? These are all the few practical points that comes up when you sit in the OPD. Then the fourth scenario, in whom Virechana Aushadha is already given, but Virechana happened in small quantity or no Virechana at all. In all these conditions, you cannot repeatedly administer the Aushadha. Or if you give Virechana, but it turned out to be Vamana. So in this case also, repeatedly administering the Aushadha is not advised. Rather, you have to give a gap of 7 days, again start with Snehapana, Snehana, Svedana, and then go for Panchakarma. This is the usual method. So two things we got clear. If digested, if the Aushadha we gave is digested, then repeat the administration of Vamana or Virechana Aushadha. It didn't get digested, no Pana, because no repetition of the Pana. Why? Because it may result into Ati Yoga. Then Vyapat, because of the Aushadha administration without prior Snehana and Svedana. Why I made you guys to repeat about the Purva Karma, Pradhana Karma and Paschat Karma is because of this. How much of an importance Snehana and Svedana has. So it can result into 7 conditions. If Snehana and Svedana was not done prior to the Shodhana, or it was not done in the proper method it has to be done, or proper amount of Snehana Svedana not done, it can result into Tamaso Darshanam, Hikka, Shvayathu, Vibramsha, Pindikodveshtana, Kandu, and Urusada. Remember these points, 7 points. First, there were 4 points we considered with Vamana Aushadha given resulting in Virechana. 5 points we studied for Virechana Aushadha given resulting into Vamana. Then now we are understanding 7 points, 7 Lakshanas where Snehana Svedana is not done prior. It may result into Vyapat. Tamaso Darshanam, Hikkam, Shvayathum, Vibramsham, Pindikodveshtanam, Kandu, and Urusada. Sorry, there's 8th point also, Vivaranata. Okay, now we are getting into the main point of Vamana and Virechana Vyapat. What are all those 10 points that are told by Acharya Charaka? Adhanam parikartishcha sravo hritgatrayorgrahah जीवादानं स विभ्रंशः स्तम्भः सोपद्रवः क्लमः अयोगादति योगाच्च दशैता व्यापदो मताः प्रेष्य भैषज्य वैद्यानां वैगुण्यादातुरस्य च. So what acharyas are saying, Vaigunya can happen because of Preshya Bhaishajya Vaidyanam Aturasya cha. So Vyapat can be resulted because of Atura Vaigunya, because of Vaidya's administration or misappropriations from the Vaidya, or the administered drug itself might be of a poor potency or not so good quantity or excess quantity. All these three case scenario of being something wrong with the patient, something wrong done by the Vaidyas, and few cases where the administered drug itself is the cause. These three things can result into 10 Vyapat, which constitutes both Ayoga and Atiyoga. So division. In that Atiyoga, Ayoga of 10 points, we will be discussing now what are all those under Ayoga, what are all those under Atiyoga. I'll say once again, Adhanam, second Parikartihi, Parikartika, third one is Srava, fourth one is Hridgraha, fifth one is Gatragraha, Jivadanam, sixth one, Savibhramshaha, seventh one, Stamba, eighth, so Upadravaha 9 and Klamaha 10. So there are 10 points. In those, 7 are under Ayoga and 3 of them are under Atiyoga. Ayoga are Adhana, Srava, Hridgraha, Gatragraha, Stambha, Upadrava and Klama. So there are totally 7 points. In Atiyoga there are 3. Parikartika, Jivadana and Gudabhramsha. I repeat, please close your eyes. Just try to recall what I say. Just try to listen to them. Okay, rather than seeing it on the screen, just try to recall them. Mind mapping. So, Ayoga and Atiyoga, two things. In that, Ayoga has 7 lakshanas, Atiyoga has 3 lakshanas. Ayoga, Adhanam, Srava, Hridgraha, Gatragraha, Stambha, Upadrava, and Klama, they come under Ayoga. Atiyoga, Parikartika, Jivadana, Gudabhramsha. These three come under Atiyoga. Moving further, what is the meaning of those 10 lakshanas? Adhana means flatulence. Parikartika, sawing pain, like cutting like pain in the abdomen. Srava, excessive discharge. Hridgraha means stiffness of the cardiac region. Gatragraha, stiffness of the body, whole body. Jivadanam, bleeding. Vibhramshaha, prolapse. Stambaha, rigidity. Upadrava, many other associated complications may occur. Then klama, mental fatigue can occur. I repeat, Adhana, flatulence, Parikartika, sawing pain, Srava, excessive discharge, then Hridgraha, stiffness of the cardiac region, Gatragraha, stiffness of the body, Jivadana, bleeding, Vibhramshaha, prolapse, Tambaha, rigidity, Upadrava, complication, any other associated complications because of the administration of Aushadha or because of Ayoga or Atiyoga of the Shodhana process itself, all those things come under complications. Then klama, mental fatigue. Further, Vibhramsha or of Vibhramsha, it also considers 3 other things. Okay, so Gudabhramsha, Sangna Vibhramsha and Kandu. These are considered under Vibhramsha. What is Gudabhramsha? Prolapse of the rectum. Sangna Bhramsha is mental perversion and Kandu means itching. So in these 10 points of Ayoga and Atiyoga, Vibhramsha has 3 other points under it. What are they? Gudabhramsha, Sangna Bhramsha and Kandu. So in the further class, we will discuss about each of them. Today it is just about the introduction of 10 Vamana Virechana Vyapats and what are all the other conditions which may result or we may find like Vyapat. Just not under the heading of those 10, but apart from it also we have Aushadha Vyapats, we have Sneha Svedana related Vyapats, we have Shodhana related Vyapats itself, or what was the condition of the patient in which something was administered. Some Shodhana Aushadha was administered, but it resulted into a different Shodhana procedure. So I repeat for all the topics of today once again. So what happened? Today we discussed about Vamana Aushadha resulting in Virechana, Virechana Aushadha resulting in Vamana. Then we discussed about number, how many Vyapats are there according to different acharyas. We defined what is Ayoga and what are all the different conditions in which Ayoga can happen. Then if Aushadha was administered, it can result into 2 conditions. It can get digested or it cannot get digested. If it got digested, but still there is no shodhana, it resulted into, then we have to repeat the process. But if it is not digested, then we need not repeat the process. If we are repeating the process, what kind of medicine has to be given? Mrudu or Tikshna, Koshtaguruta or Laguta has to be considered, Bala has to be considered. Then when we are not giving, if it is not digested, we are not going to repeat the medicine. So what are all the conditions in which we are not repeating the medicine, or we are repeatedly not administering the aushadha? Those cases we discussed. Then we discussed about Vyapat because of the aushadha administration without prior Snehan and Svedana. 8 points we discussed. So Tamaso Darshana, Hikka, Shvayathu, Vibramsha, Pindikodveshana, Kandu, Urusada, and Vivaranata. Then we discussed 10 points under Vamana Virechana Vyapat of Charaka Siddhisthana 6. These can be resulted because of three case scenarios. One is because of Atura Vaigunya, Vaidyanam Vaigunya, and Preshya Bhaishadya Vaigunya. Then division can be two ways, Ayoga and Atiyoga. In Ayoga, we have 7 points. Atiyoga, we have 3 points. Then we discussed about the meaning of each of them. And Vibramsha is one among them which has 3 further divisions. One is Guda Bramsha, Sangya Bramsha, and Kandu. If you have any doubts for today, you can ask me, or we will end the class here. And in two or three days time, I'll consider taking another class where we can discuss about each of those 10 points of Vamana and Virechana Vyapat. रागादिरोगान् सततानुशक्तानशेषकायः प्रसृतानशेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै. I'll end the class here.